Good afternoon. My name is Mike Savelle. I'm a student at Auburn University, and this is going to be a presentation on fibrocystic breast disease. Fibrocystic breast disease is basically a way of describing the tissue change that happens in a woman's breast. Normal breast tissue changes to a more rope-like glandular tissue. It's often described as a lump or a cyst type tissue. It becomes a fluid-filled sac inside of breast that replaces the normal breast tissue. The exact cause of fibrocystic breast changes is unknown. Most providers agree that it's related to hormone fluctuations in the menstrual cycle. Providers also agree that since over 50% of women now have some sort of fibrocystic change in their lifetime, that this is not really a disease, but just a change in the healthy breast tissue. The women who are most highly at risk for this are women obviously in their 20s, 30s, and 40s, and even early 50s who are still having a menstrual cycle. They have the hormone changes that can cause these issues. Also, women that are receiving hormones because they no longer have their ovaries or have had a hysterectomy are also at great risk. Women who smoke, they're obese, they don't exercise, and women who have a diet high in saturated fats are also at great risk for fibrocystic changes. A key question to ask a patient who comes in with lumps in their breast is, do they have a personal history of breast cancer or a family history of breast cancer? Because the answer to that question is more than likely going to steer how you treat that patient from that point on. Secondly, when they discover the lumps in their breast, the lumps fluctuate based on their menstrual cycle. Typically, fibrocystic breasts are correlated directly to the menstrual cycle. And then thirdly is, what symptoms are the patients having? Typically, fibrocystic breast patients have a great deal of pain. And if pain is their issue, then we can definitely help treat the pain and help the patient enjoy a better life. Your clinical exam is going to revolve around palpation. You're going to palpate the breast bilaterally. Unilateral lumps may indicate something other than fibrocystic changes. You're also going to palpate lymph tissue in the neck and the underarms. You're going to want to make sure that you feel the rope-like nodules. You're going to ask the patient if they've been doing monthly breast exams at home and if they feel rope-like nodules when they inspect their own breasts. You may want to have the patient come back in several months in a row to try to determine whether you feel like the changes are decreasing and increasing based on the menstrual cycle. As far as diagnostics, mammogram is going to be your first line. They're going to be able to see changes in breast tissue. Past that, you can do an ultrasound. The ultrasound is also very specific. You're going to see fluid-filled sacs in the ultrasound, which you won't be able to do with the mammogram. The fluid-filled would indicate that those were fibrocystic, whereas a solid mass would be something more like cancer. Needle aspiration and tissue biopsy are also good. Needle aspiration, you can pull off fluid from the breast, which acts as both a treatment and a diagnostic tool. And the tissue biopsy is probably the most definitive way to tell whether cells are normal or abnormal. The goal in treatment for fibrocystic breast disease is pain management. Typically, over-the-counter medications such as Tylenol or NSAIDs are used. In certain cases, stronger medicines can be prescribed. Also, birth control pills are prescribed by many providers because birth control pills help to regulate the hormones that fluctuate with monthly menstrual cycles that tend to aggravate some of these fibrocystic issues. In certain circumstances, fluid can be drawn off fibrocystic tissue. This is done through fine needle aspiration. And in most extreme circumstances, surgery is necessary to pull out large fluid-filled sacs that are causing patients extreme pain. Women who are experiencing fibrocystic changes are typically encouraged to spend money on a high-quality bra. They're encouraged to wear sports bras at night when they sleep. This typically reduces fibrocystic symptoms and helps to improve their daily life. Also, lowering or eliminating caffeine and saturated fats from the diet tends to help with fibrocystic changes, and a healthy lifestyle such as regular exercise, smoking cessation, and 8 hours a night of sleep also helps with fibrocystic breast problems. Postmenopausal women who have painful fibrocystic breasts are also encouraged to speak to their primary care provider about reducing or stopping hormone therapies. In summary, we want to monitor our patients that we feel may have fibrocystic breast problems. for fluctuations in their breasts based on their monthly menstrual cycle. We also want to make sure that we're treating the pain that these patients are having with over-the-counter medications or prescription medications if necessary. We want to watch these patients and their diets. We want to watch their sleep habits, and we want to make sure that they're practicing smoking cessation. Also, we want to watch these patients very closely to make sure that they're not having unilateral lumps, which may indicate something much worse like cancer. The U.S. Preventative Task Force also recommends that all patients over the age of 40 start to receive a biannual mammogram.